Good morning, it's Dr. Wendy Fortna here with another update for COVID-19 in special areas number 2 and Hanna. Today is Tuesday, March 30th. We're getting close to the end and sure did go out like a lion this time. And I'd like to give you some information mostly because of my stack. You can see the thickness here, the number of questions that I had on my desk this morning. I will apologize to you. We've had a change in administration at the Hanna Medical Clinic, and so there was some of the questions that got lost for a week or two, so some of these may feel a little bit outdated, but I'll do my best to make them relevant for you today. So as of this morning, we have 11 active cases. I'll call this sort of wave 3 in Hanna. We had a wave of cases in the summer. We had a wave of cases that sort of came up in conjunction with kind of the rest of the province in that December-January time, and now you'll notice the numbers all over the province are rising again, and we're calling this wave 3. So for us in Hanna, this wave 3 has so far consisted of 22 cases of COVID-19. A lot of you have asked me whether or not any of these are variants of concern. As of my last update from Central Zone, none of the ones in Hanna are variants of concern, but I will tell you it is only a matter of time. There are variants of concern in Drumheller, in Lacombe, in Red Deer, in Wetaskiwin. They're everywhere now. And so eventually I suspect that either the variants of concern will overwhelm the original COVID-19 concern, or they will become equally affecting us. So it is only a matter of time. And now many of you have also asked me, why are these variants of concern? So when we looked at the original COVID-19, we were concerned about a number of features. We were concerned about how easily it spreads, its transmissibility, how easily can an infected individual give it to others around them. We're concerned about virulence, how severe is the infection, and we are concerned about whether or not vaccines are going to be effective against this particular strain. So the new one you're hearing about mostly in Alberta has two different names. It's going to be the UK variant, which we're trying to avoid using, even though it's a lot simpler, than the B1117. So I'm going to call it the UK variant for ease here, and that is the one that we're seeing predominantly in Alberta. We're concerned about this one because it has increased transmissibility, meaning it's easier to give it from one person to another, whether they have symptoms or not. And it has increased virulence. So the likelihood that you're going to get a severe infection with the UK variant is higher than with our, we'll call it wild type or original variant. Vaccine effectiveness, thankfully, has been pretty darn good when it comes to the UK variant. So most people in Alberta have been receiving the mRNA vaccines, either the Moderna or the Pfizer, and our real-world studies from the UK have shown us that these vaccines are really very effective against both the wild or original type and the UK variant. So this is reassuring, but we're concerned and we're thinking that we're going to be seeing more hospitalizations and severe cases because of that increased transmissibility and increased virulence of these variants of concern. So I'm going to get back to my questions now. So that got rid of question number 1, question number 2, and a little bit of question number 3. So this particular question was saying these cases are rising rapidly in the town of Hanna right now. Can we please remind everyone to use proper protocols, including masks, hand washing, and social distancing? And in fact, these measures have not changed. With the variants of concern around, it's really important that people continue to be vigilant with this. I agree, we are seeing some people deciding that it's no longer important to wear masks in our community. The weather's getting a little bit warmer. You can't really stop people from declaring themselves as unable to wear a mask. But I would say if you can, please continue to follow these measures. The rules are in places like our post office. You must wear a mask when you go into the post office, even if there aren't other people there. We don't want debris from coughs and sneezes to be sitting on other people's mailboxes when they go in there. Social distancing of that 6 feet or 2 meters is still advised everywhere you go, outside of your original cohort. Right now, indoor gatherings are prohibited, which means that socializations inside of our homes, according to public health, is supposed to be only the residents that live in that dwelling, i.e. me, my husband, my children, for example. These single individuals, those who live alone, are still allowed to be a part of 2 other contacts. So you mean grandma might decide to be a contact with yourself, single sister-in-law might decide to be a contact. These rules haven't changed. Please keep vigilant with them. As always, I will push the message, if you are sick, Do not presume that what you have is a common cold. Consider that it might be COVID. Please consider that. Okay, next set. Why are all of these cases happening in Hanna? Where are they coming from? So I cannot, as you know, talk about individual medical information. We have seen a certain increase, we'll call that wave 3 coming through Hanna. The vast majority of cases have been connected through easily identifiable either household contacts or workplace contacts. These are all coming from what we would call close contacts. They are not people acquiring it when they touch the gas handle pump at our local service station. The cases are coming from my husband has it, therefore I have acquired it because I am his close contact, for example. Or a classroom contact, 2 kids playing together might acquire it. We are not seeing a large amount of general community spread. We're seeing identifiable contacts. Okay, next sect. So what advice can I offer for people who have a high-risk loved one living with them but are not yet eligible for that vaccine? As I've said, because it's usually close contact that is spreading this disease, it's really important that if you have a high-risk individual in your household and you become unwell, you should isolate as much as possible from that high-risk individual. So if you have common cold symptoms, that sore throat, the runny nose, what you would want to do is make sure that you're using proper hand hygiene and that you're not getting within that 6 feet or sharing meals with that high-risk individual. If that individual becomes eligible for vaccine, it would be important for them to get that vaccine to give them the added protection. They should continue to practice social distancing in the community as well as in that home if somebody is unwell. I think that's really all you can do. Follow the rules as we see fit. It is still safe for people to wear their masks and go out walking. Well, you don't have to wear a mask when you go walking outside, but go to the grocery store with your mask on. You'll notice that the clerks in the grocery stores are wearing their masks as they're required to. So I say that's pretty much it. Do your best, be vigilant. Is contact tracing caught up, and is it being done with the outbreak in Hanna? Yes, it is. So you'll remember that what happens is an individual has to submit everyone that might be a close contact of theirs. So let's consider a workplace environment. If a workplace has a shared eating space where people are, say, 1 meter apart at a dining table, everyone who is in that dining table is going to be considered a close contact. So those people are informed by the workplace or by the individual that they are a close contact and required to isolate for 14 days from the last date of contact. So let's give an example because I know that's kind of convoluted. If I go to work and I am feeling fine, but I wake up Saturday morning and I am sick. I have a sore throat, I have a fever, I call 811 and I go and get a COVID test. I find out on Sunday that I am COVID positive. I have to go back to when I first developed symptoms, which is Saturday morning, and I'm going to end up being told to count 48 hours or 2 days before I first presented symptoms, and I have to consider everyone then, both on Thursday and Friday, that I came in close contact with. This is people that I sneezed or coughed on without wearing protection, people that I had no mask on and I was within 2 meters of contact with them for a prolonged period of time, and I'm going to be responsible for letting all of those individuals know. And then they would be isolating for 14 days from the last date they saw me. If our last date of contact was Friday, it's 2 weeks from Friday for the contacts. For me, I will have 10 days of isolation from the date of symptom onset, so 10 days from Saturday morning. Kind of confusing, but definitely talk to your family physician or talk to the contact tracers when they get in touch with you if you're concerned or unsure about how long you or a loved one would be required to isolate. All right, so this brings us to another one. This is one I just received today. With all the positive cases that have been happening in Hanna, there has been some bullying and gossiping in the community. Who has it? Maybe ostracizing some individuals. What do I say to them, and how do we stop this from happening? So I'd bring us back to a general principle of what defines a bully and why do they become a bully. I think the first thing is fear. People are bullying because they're afraid that the individual that they think or know has had a COVID infection might get them or their loved ones sick. This is where it pulls back to that 10 days of isolation. An individual is considered infectious for 10 days from the date of symptom onset. So as for previous example, if I became symptomatic on the Saturday, Let's say that 6 days later, I feel great. I'm totally symptom-free. I continue to isolate for the last 4 days of my isolation time for a total of 10 days. Then I can go out into the public. Now, where some of the confusion lies, I think, and we actually talked about this on a previous video, is that when an individual gets tested might not be day 1 of symptom onset. If I get sick on Saturday and I'm thinking, oh, maybe I just had a little bit of a snow mold exposure and that gave me a runny nose, and I sit at home, maybe relax, I don't think book a test until Tuesday or Wednesday, I'm already 4 days into my symptoms and maybe 5 or 6 when I get that positive result back. That doesn't mean I have to isolate for 10 days from the date they tell me my test is positive. It was 10 days from symptom onset. So you may see someone out and about in the community who only got their positive test result 2 days ago because of when their symptoms started. That doesn't mean that they have to isolate longer. It's kind of confusing. You do not need to bully, and you should never bully, but you don't need to be afraid of people who are out in the community who are feeling well and more than 10 days from symptom onset. It's hard to know that. I had one person particularly in my practice who brought up a concern of how do I not scare people when I go to the grocery store because they all know that I had COVID. And my advice to them was simply to be as open and upfront as they can. Hey, I'm out here, I'm wearing my mask like I'm supposed to, because you still have to follow rules about isolation, mask, and hand washing, even if you've had COVID. But you know what? I got sick 2 weeks ago. I've been feeling great for the last few days. I'm off of isolation and I can't infect you. I always try to counter misinformation with lots of openness and positive information. So number 1 is fear. Number 2 as to why I think bullying might be happening is anger. Because we might assume that a person acquired their infection because they were negligent, because they did not follow the rules. What if you've been staying in your house, you haven't had contact with any of your loved ones, you're missing them, and you're angry that someone else got a COVID infection? We don't know. We are speculating why people got these infections. And we know that no one is considered immune from infection at this point as far as their behaviors. People acquire it from work, inadvertent exposure to someone they're doing an essential project with. Maybe they are an essential worker in a grocery store, in a hospital. Maybe they got it from their child who got it from school. We don't know. So please don't speculate how people acquired their infection, and please don't judge as much as you can. We really don't know, and we need to respect and be grateful that people are back out in our community and feeling well. Maybe they were very lucky and had a minor infection. Not everybody is. So in summary, we can't stop bullying, but try to be open up front and as much good information as possible to minimize bullying. Okay, what happens if Hanna is put on enhanced watch? Are there new protocols in place? This is sort of an antiquated term, I would say, from the fall. Remember back then we had fewer than 10 cases, whereas Calgary and Edmonton and parts of the corridor had more than 10 cases or greater than 50 per 100,000. Those places were put under watch and they had increased restrictions, particularly around things like children's activities. So while our hockey and dance and taekwondo and gymnastics continued in the fall because we were not under enhanced watch, Calgary and Edmonton, and I think Red Deer as well, were under enhanced watch and had to cancel those activities. Right now, it's a caution for us to remember that there's increased activity in our zone, but there's no increased precautions or rules in our community as a result. When we drop below 10 cases, and we're close at 11, you'll see our color change on the map into more of that tan color or white color if we have no cases. I promise it's getting shorter. Okay, if someone tests positive and has a local address on identification but lives in, say, Lethbridge, does this positive test get recorded under Hanna totals or Lethbridge? Initially, that case will go under whatever address is listed on that patient's testing form. So if they are a university student in Lethbridge but they still use their Hanna address, that case will be listed under Hanna. However, when contact tracing gets involved, they will find out that individual lives in Lethbridge, and then that case will be transferred to the Lethbridge area. Sometimes that takes a very long time if they're behind, and that case might not be transferred for days or weeks. For now, assume that if the positive case is listed under Hanna, they probably reside in Hanna. Can we get our second vaccination before July? I was told it couldn't be booked any sooner. How much information can you give me? So as you know right now, the initiative of the Alberta government, and in fact all the governments in Canada, is to get every adult vaccinated with one dose that wants it as soon as possible, rather than trying to get the full complement of 2 doses for every adult. They think that this is going to happen by the end of June, which is why we're giving July as the time when most people are going to start getting their second shot. If we get a massive influx of doses of vaccine, it's very possible that you'll get that dose sooner, but until every adult is offered one, do not assume that you'll be able to get your second shot. This should be from March and onwards into our regular time period by getting that 4 months in between doses. I would love it if there was extra vaccine and we could give people their second doses, but for now, I don't think you're going to get them sooner than July. Just listen for extra information as it becomes available when those second shots can be booked. Ooh, this is one that's hot in the news right now. How safe is the AstraZeneca vaccine? Now there's these reports of blood clots going on. Is this safe for me if I'm in the 50 to 65 age group? So I actually had to do some extra research on this one and figure out exactly what's been happening with the blood clots. So as you know, AstraZeneca is a viral vector vaccine, different than the mRNA vaccines. And once it was released into the general population, we have what we call post-market or real-world data. Sometimes this gives us good information about a vaccine and sometimes bad information. We have learned, which is great, that it does work really well in our senior population and in people with comorbid conditions. That was something we didn't know from the initial vaccine data. We have also discovered, however, that there is a negative side effect, a concerning side effect, that is associated in some people with the AstraZeneca vaccine. So the actual data discovered that there were 25 cases of unusual blood clots after 20 million shots were given, primarily in Germany. In these cases, it's unusual clots, so it's not the one that you may have heard of, a clot in the leg, a clot in the lung. It's a clot that occurs in the brain, a CVST, or central venous sinus thrombosis. This is a very strange type of clot to occur, and that's why we're getting more and more of both the timing relationship and the idea that it might be caused by the vaccination. In these cases, particularly we have data on the ones out of Germany, and the 21 cases of that, 19 were in women and only 2 were in men. The women occurred between the ages of 20 and 63, but almost exclusively before the age of 55, and the men occurred at 36 and 57. So a very small number of clot events in a very large number of vaccine doses. As a result of this occurrence, a number of European countries temporarily halted giving the vaccination. Other countries have started giving the vaccination, but choosing to only give them to seniors now, which is an interesting flip from the beginning of this dosing because none of the clots occurred in our senior population. And Canada right now has put the vaccine on hold so they can do extra research. This is a very common thing where a drug of any sort comes onto the market and we see something unexpected happen. In this case, it highlights for you the safety around vaccine monitoring. Even though it's a very small number of events, by monitoring the huge population that's been receiving this, they've identified it and they're going to figure out what the actual risk is and whether or not it's safe to continue giving it to Canadians of both genders and multiple ages. So right now there is no availability of AstraZeneca vaccine for Albertans, but keep your ears peeled to the resources online in the news and when it's going to be offered again, or if it's going to be offered again and to which population, that will be made publicly available. Okay, we're on our last set. So this question was submitted, and I'm not sure which individual did this question, but it's sort of beyond the scope of what the purpose is of these information videos, asking some very detailed scientific information. So if this starts to get kind of over the head or become too confusing, I'd encourage you to say goodbye and come back next time, but I'll do my best to answer this individual's questions. They would like me to make people aware of the fact that the vaccines have been approved under emergency purposes or temporary purposes, and that is true. All of these vaccines were put through a rapid approval process in order to ensure that they were made available to Canadians and people around the world. They still went through phase 1, 2, and 3 trials, but in an unusual circumstance, the Health Canada administration allowed people to submit data as it was being created rather than waiting for the very end and submitting a cumulative report. As a result, they could begin review much faster, and we got faster approval for it. There is ongoing surveillance of the population that has been vaccinated, as we've already discussed, and that will continue for many years, looking for adverse side effects from vaccines. There is a repository in the United States of adverse event reporting from vaccines. This is a database that anybody can go on to and submit a reaction. Whether or not it is truly related to the vaccine remains to be seen. And it just creates a giant list of all side effects. I'm very cautious about using this VAERS repository myself because it's not vetted through any educated medical professionals. It is submitted by lay people. And so it's a list of what people may or may not think has been attributed to their vaccine, but it's not fully associated. So for example, of the 2,000 plus deaths that were reported by lay people to be associated, every one of them was investigated by the FDA and found to have no association with the vaccine itself. So if you're going to be looking at this data, do so with a cautious mind. A reminder that the vaccine is not 100% effective, and that is true. We know that it's in the 90s, at least for the mRNA vaccines. So being 92% effective means that it's 8% ineffective. That's why we still require people to wear masks and practice social distancing even if they've been vaccinated. We do know that it's 100% effective at preventing serious infection, death, hospitalizations, but there is still a chance that you've been vaccinated and you can acquire a COVID-19 infection. Finally, they've asked me to talk a little bit about animal studies. What I'm going to tell you is that using data from an animal study to assume that it's going to happen in a human study is a dangerous connection. In animal studies, they're given much higher doses and concentrations of medication to try to elicit a toxic dose. We don't give those dose equivalents in human beings. We use the human data when we're going to talk about the effectiveness of a vaccine, not the animal data. You've also asked me about antibody-dependent enhancement, or ADE. This is a very unusual condition that can occur in some viral infections. It's particularly documented in dengue fever, where an individual acquires an infection and then they actually have a more severe infection the second time because of the antibodies produced from the first. It created some complications when trying to come up with vaccines for things like RSV and dengue. Scientists are well aware of this phenomenon and have specifically tried to target areas of the coronavirus that will not create antibody-dependent enhancement with the vaccines that are out there. And so far we have seen no association with people who have had a coronavirus infection end up with a more severe COVID-19 after vaccination. So at this point in time, there's no evidence that ADE is occurring, but it's actively being monitored in the world, in Alberta, in Canada. And so I'm afraid that at this point I just have to tell you that it's not particularly relevant in a discussion of risks and benefits of current vaccination. If it becomes relevant that I'm aware of, I will certainly make that available to Albertans and to people from Hanna. So that's it for this week. It's a long one. I am tired. I'm going to try to give 2 weeks between this one and the next one so I can focus on my job as a family doctor and not necessarily as a COVID information provider. So thank you very much. Wash your hands, continue your social distancing, stay home if you're sick, and I'll see you again in a couple weeks.